We're talking about 325 million people, and that's not going to happen, as you can imagine. And no, it would never happen with anyone else either.
Right now in the United States, we're testing about 100,000 people per day for coronavirus through a variety of means: point-of-care test, traditional in vitro diagnostics at public health laboratories and commercial laboratories and academic hospitals.
I'm reporting today that we passed 2 million tests completed in the United States, first time. Most anywhere in the country. It's a milestone. For our country, it's a milestone. Anywhere, nobody's done anywhere close. Our tests are highly sophisticated and highly accurate.
The biggest roadblock right now to get more people tested is really twofold. One is basic materials like the swabs to take a sample from a person's nose or throat. There's a capacity question of how many tests these clinical laboratories can actually run per day. So we're seeing commercial laboratories inch up their capacity a little bit day by day, but they're saying that the amount of machines that they have and that amount of actual test kits that they can run per day is becoming a limiting factor as well. There's a pretty wide disparity of where we are currently testing state by state. New York and New Jersey have both been testing quite a lot, but they're also finding high incidence of disease in their states, whereas some other states, some states in the South in particular, have been lagging a little bit behind on that amount of testing. Some of the states that are testing a little bit less for coronavirus usually are finding that lower proportions of the people that they test actually are positive for the disease.
If you've taken the antibody
Have I been tested for?
Yes.
Not that I know of. I've had some tests.
Does anybody
No?
else here
They
been
tell me
tested?
no. I'll
Has
accept
anybody
it.
else in the task force been tested for antibodies?
We don't have a test.
You don't have the test.
That'll come out. They've just developed those tests, sort of new.
Okay, good to know.
So antibody tests, otherwise known as serological tests, are tests that usually take blood from an individual and samples it for the presence of antibodies for coronavirus. And the hope is that this is evidence that a person has already been exposed to the virus, and you're going to be able to collect these antibodies even after a person recovers from the disease. And the reason that this is important is that it might give health researchers a better sense of what spread has looked like in communities, even if they weren't picking up on disease spread when the actual virus was present. The CDC has laid out guidance as to who should get priority access to these tests. So those generally are healthcare workers on the front line, seniors because they're more vulnerable to the disease, and then also people with underlying health conditions or those who are immunocompromised.
We're seeing tremendous evidence that African Americans are affected at a far greater percentage number than other citizens of our country.
We're already seeing in the statistics mortality and incidence of disease. It's hitting Black and brown communities more than areas of privilege in this country. We might be seeing higher fatality rates in certain communities in the United States, include underlying health conditions in those populations like diabetes, obesity, asthma, and just a general lack of access to health care.
Going forward, we now have a code for coronavirus, so we can actually stratify by demographic information, so we can look at race as a factor.
Minority communities are particularly affected by a pandemic like the coronavirus. Systematic health challenges to getting health care, including having actual health insurance and making sure that you have access to a primary care physician.
Health disparities have always existed for the African American community. But here again, with the crisis, how it's shining a bright light on how unacceptable that is. Now, I expect that when African Americans get infected, given the disproportionate disparity of the underlying conditions that lead to complications like the ones I mentioned, I expect that we will still see the pattern that when you look at the proportion of people who get into serious trouble and die, again, it's going to be disproportionate towards the African Americans.
Some public health experts have said that we really need to create a randomized testing regime to get a greater idea of what the spread of disease looks like to move towards case-based interventions, which would encourage people to self-isolate.
Mr. President, how can the administration discuss the possibility of reopening the country when the administration does not have an adequate nationwide testing system for this virus? Don't you need a nationwide testing
No.
system for the virus before you reopen the
We have a
country?
great testing system. We have the best, right now, the best testing system in the world. And what we'll be doing in the very near future is going to certain areas of our country and do massive testing. It's not necessary, but it would be a good thing to have.
But right now, the CDC says that testing of asymptomatic people currently is a non-priority, and that I think is really reflective of the limitations that we have on supply of testing materials to date.